I think I need to speak with you a little bit more. As you notice, I'm walking up here with a cane, and I think there's one thing that we need to build into some of this aging process, and that's a way to avoid stupidity, okay? And this is a result of me thinking I'm still about 22 years old, hiking and climbing in the Andes Mountains, meaning that when I get back home, I have to have some rather extensive surgery. Okay, so I liked a lot of the images that you had. I thought that probably applied to me as much as to anyone. I want to talk about the over-the-counter hearing aid activity in the United States. It's a topic that has come up, and I've been asked to comment about it. I want to make a disclaimer here is that, first of all, I am an independent. I have written extensively on PSAP and over-the-counter, on our blog site. But I'm trying to give you a rather objective presentation today on exactly what has happened and where we are today with this. And in doing this, what I want to do is I want to give you a little bit of background, how this came about, and then finally to explain the law itself. In the United States, government regulation of hearing aids started in 1977. It's not new. And in 1977, it was designed to protect the health and safety of hearing impaired Americans. And there were two parts to the law to begin with. The first part really had to do with things that manufacturers had to do to the hearing aid and to their labeling. In other words, they had to put labeling onto the hearing aid, identifying the product, what it was, who manufactured it, the dates, all of this type of thing. They also had to provide information relative to the user instructional brochure. They had to put technical data, make this available for the products. The second thing that related to the regulation in '77 were the conditions for sales. And this related primarily to the dispensers, to those of you dispensing hearing aids. And these things had to be done before the hearing aid could actually be sold to the consumer. One of the things is that you had to have a written okay from a physician saying that there was no medical reason why you should not be able to have a hearing aid. And even at that time, there was some controversy about this because many people thought, for medical or personal reasons, I don't want to go to a physician. So they did put an option in there for a waiver that could be signed by the consumer. And this was the waiver you see on the bottom. I'm not going to read it all. But it had to come from a physician and had to be signed saying there's no reason why a person shouldn't be able to have a hearing aid. There are no medical reasons why this should not take place. They also, as part of the requirements for the FDA, the dispenser also had to review the patient in light of what were called 8 red flags. And these were things that you looked at that related to whether there was any discharge from the ear, any abnormality. It had to do with the way you looked at the audiogram and if there were big differences between the ears that might suggest acoustic neuroma or something of this nature. So you had to do this, and of course the thing that also had to be done by the dispenser is that you had to go over the user instructional brochure in detail with the patient, and you had to do this with them prior to the time that they actually purchased the hearing aid. Meaning that what you had to do, you had to discuss with the patient the equivalent input noise, you had to talk about total harmonic distortion, the frequency response range, all of these kinds of things. This was a requirement in the mandatory regulation in 1977. In that time, the FDA also defined the hearing aid for the first time. They defined it as such. It's a wearable instrument or device designed or offered for the purpose of or represented as aiding persons with or compensating for impaired hearing. Okay, kind of a pretty broad definition here. It did exclude auditory trainers. If you really take a real close look at that definition, it's so broad that telephones and everything else actually would be considered as a hearing aid, hearing device, if you looked at it. Regardless, this is what they came up with, and this is what they used. And this remained unchanged until 2009. So from 1977 to 2009, that definition and these requirements on the dispenser and manufacturers remained. By 2009, they realized that there were other hearing help products that were increasingly being sold. And because of this, they came out with a FDA guidance relative to hearing aids and PSAPs in 2009. In other words, they tried to distinguish between these particular groups. The hearing aid, pretty much the same definition that we'd had up here. But the rule, this remained unchanged, and the guidelines were in 2009, and those guidelines remained until 2013. 2013, there was a proposal to revise the guidelines because of many other types of instruments that were being sold and used by hearing impaired individuals. Interestingly enough, even though those guidelines were proposed to be revised in 2013, they still have not been implemented. And we'll see later why they have not been implemented. And they may be a while before they are actually implemented. But why did the FDA propose guidance in the first place? Why did they think they had to put out a guidance to distinguish between hearing aids and PSAPs? Well, the primary reason, and one of the things that happened, as we all know, that the hearing aid sales landscape changed quite a bit during that time period. It's not that the population really changed significantly. We still had hearing impaired individuals. It's not that hearing aids changed that much. We were still using them to amplify and to provide amplification to individuals. But as you can see by this, the distribution changed a little bit during that time period. And so certain seeds had been planted during that time. And as I think we all know, when you plant a seed, it takes a while for the product to appear above the ground. There's a lot of work and everything else that occurs and takes place below the ground during that time period. And this is also true in what happened in the hearing aid field. Additional seeds had been planted and sown. In other words, what happened, there were different hearing aid options that were available. Now, this started to be of some concern to dispensing audiologists and licensed hearing aid dispensers. The first thing that happened, there was kind of an explosion in the sale of hearing aids directly to the consumer. Even though we had a law that said this is what a hearing aid is and how it had to be applied, this is an ad from USA Today in 1997 by Crystal Ear, selling hearing aids directly to the consumer. Consumer wrote in, ordered the hearing aid, it was sent directly to the consumer. Hearing aids also were sold under the advertised claims of being an assistive listening device. Remember, the FDA regulation didn't control assistive listening devices, didn't have a definition for them. It actually excluded them from this. So some people said, well, this isn't a hearing aid, this is actually an assisted listening device, and so we don't have to follow the regulations because we don't call it a hearing aid, it's an assisted listening device. And so many of these were sold. Some were actually sold as hearing aids. We had the Bionic Man, the Bionic hearing aid, the $6 million man, Steve Austin. He promoted the Bionic hearing aid for a number of years. Now, there were many other things, but were these unit sales even significant? We don't know. Well, we kind of know in retrospect now, but we didn't know at the time. Why didn't we know how many of these products were actually being sold? There was no mechanism, there was no organization to actually document any of this. There were no requirements for this. I can tell you what we have found out since that time, because in some cases what has happened is that some of these companies had been sued for violating the 1977 Act. But let me give you one example. Telebrands that made one of these products here, in 1 year, we know this after the fact now, sold 1 million of their products. The hearing aid industry in the United States during that same time period sold 1.5 million hearing aids. So the thing is, these are things that we didn't know, but we kind of know now. And we always had, and so a lot of people asked, well, why are people buying outside of the normal distribution channel? The medical model that we've set up, why are they buying outside of that? Well, the thing is, we found out a lot of these things happen. Additional occurrences took place that provide additional seeds. Citizen petitions in 2003 by Meade Killian. He suggested at that time that the FDA actually create an over-the-counter hearing aid classification. Okay, now he said, I think this would be very good, especially for a one-size-fits-most hearing aid type device that meets the safety and efficacy requirements of the FDA. It's kind of interesting, coincidentally, it kind of followed at about the same time that the Songbird disposable hearing aid came into existence. Another citizen petition was filed by Gail Goodmanson at that same time to actually modify the 1977 rule. And the reason you have two primary components to this. One of the things she says, well, you know, the waiver. We've got this waiver out there. And in reality, the waiver was being used by dispensers about 100% of the time because nobody wanted to send their patient to the physician and put an extra step in there because many people wouldn't follow through with it, or the physician, in those cases, many of them had an audiologist working for them, and they would sell the hearing aid at that particular place. So they really weren't particularly interested in sending them to the physician. They didn't think it was necessary. So during this time period, the waiver was used almost 100% of the time. And so Gail said, well, if people aren't using the waiver, then why do we even, I mean, if we have this as a law, but people are using it all the time, let's just get rid of the waiver rule. It doesn't make any sense. The other thing is that there were certain things in the user instructional brochure that probably could be eliminated. For example, can you imagine having to sit there and go through and explain to the patient in their own language, if that was required, or their method of communication, exactly what you meant by equivalent input noise, okay? Would you like to sit there and try to explain to them what they really mean by the total harmonic distortion or what the frequency range was and how it was calculated, you know, and all of these type of things? It didn't make a lot of sense. And so they were asking the FDA, let's get rid of these things because they're really not significant and important and aren't really helping the patient population at all. In fact, they're burdens, they're hindrances in what we're doing. Well, the FDA rejected the petitions in 2004 because they believed that the physician was still necessary to be involved in making these decisions. Well, what happened? Just this past couple of years ago, they then determined that the physician requirement was not necessary, so let's get rid of it. It took them that long to actually come up with the solution to what we knew should have been done in the first place. But now that we had different people and different ways of selling hearing aids involved, a snowball had started, and the snowball starts to build. During that time period, 1977 to 2013, hearing aids were actually sold in a variety of ways. Classified hearing aid ads, you know, in the newspaper, you could find them. Direct mail, we're all pretty familiar with this. Some of us still use direct mail as a method to get to consumers. Catalog sales, get a catalog, order the hearing aid from the catalog. This was happening. Newspaper and magazine ads, we still see them today. Television ads, a $6 million man, the bionic ear. The internet has become a very, very big sale of hearing aids in our country. Big box stores, you know, are around. We see these all the time. And we have not only traditional dispensing today, but we have something even a little different than that, and that we have manufactured-owned operations dispensing hearing aids as well. So in other words, they own the retail operation as a manufacturer. And so it's kind of a mixed bag that we have today. And the professional organizations, they realized that, and they had certain reactions to these kind of trends. And so they took steps, either together or individually, to try to make some changes in the way that the hearing aid purchasing options were there. And they sent letters to the FDA saying, hey, we really shouldn't do this because people are violating the FDA regulation. They really should see a hearing professional beforehand. They put out articles and advertising materials promoting the professional only as the dispenser of hearing aids. And they indicated that their professions were necessary to protect consumers against the dangers of fitting without an audiogram or a licensed professional. And these groups that were involved this way are the groups that we would ordinarily expect. And in our country, they happen to be the following: the AAA, the International Hearing Society, the American Speech Language Hearing Association, the Academy of Doctors of Audiology. These are the groups that said, you know, and let's face it, these are the groups that had the vested interest, the biggest interest in this. Well, the FDA then responded to their inputs. They listened to them. They had what they had to say. And so they said, well, yeah, we understand. There's products that are out there that are being sold. Some are outside the hearing professionals' control, and we see that. Of course, the hearing professionals wanted them within their control. And some of them were actually outside the 1977 hearing aid rule, in that they were actually being sold as hearing aids, even though they may not have been hearing aids. They may have been called assistive listening devices, but they were still basically hearing aids. So this is when the FDA published their guidance for industry and FDA staff on regulatory requirements for hearing aid devices and personal sound amplification products. This was really the first time that the term PSAP really came into play. And this guidance actually defined what the hearing aid was versus the PSAP. And what it was is that they found out, they commented, first of all, that we know that both of these actually affect the ability to hear sound. But they have different intended uses. And because they have different intended uses, then they are subject to different regulatory controls. For example, the hearing aid is considered a medical device, and so it has to follow the medical controls. However, if it's a PSAP, it's a consumer product, and then it can follow consumer controls, and these are very, very different. Well, what they did is they said, well, the hearing aid, they defined it this way, and this is pretty much the same definition as we've seen. You know, it's a wearable sound amplifying device intended to compensate for impaired hearing. And they said a PSAP, on the other hand, is a wearable electronic product that is not intended to compensate for impaired hearing, but rather is intended for non-hearing impaired consumers to amplify sounds in the environment for a number of reasons, as for recreational activities. Well, the recreational activities that they talked about here were listening to birds and things of this nature. Well, you know, it got to be such that when you looked at it and you looked at what the FDA had to say about it, they said, you know, while some of the technology and the functions of hearing aids and PSAPs are very, very similar, it's the intended use of these that determines whether it's going to be called a medical device or whether it's going to be called a consumer product. Now, if you look at that terminology and you think about yourself, well, you know, how do I make that real distinction? You know, isn't this kind of a gray area that we're dealing with? Well, obviously, the definitions led to confusion. And they said, and even the FDA said, well, you know, as we look at it, well, I guess a PSAP amplifies sound. We can't logically ignore this fact. And the thing is, it can help some people hear better because it amplifies sound. It performs some of the same functions as does a hearing aid. So why not say that it can be used to help some hearing losses? Well, the distinction between hearing aids and PSAPs was really becoming very, very blurred. I think you people understand this as well as anybody in here. And so the FDA, this is when they attempt to clarify this, but putting out the revised guideline in 2013. And we'll see the 2013 guideline did nothing to clarify it. It actually made it more confusing than ever before. And so they put out the document and the hearing aid description same, but they changed the description of the PSAP. And you can see what it says here. It's, you know, this is what the hearing aid is. And the PSAP, it says, because it's not intended to diagnose, treat, cure, or mitigate diseases, and does not alter the structure or function of the body, it's not considered a medical device as defined in the Food and Drug and Cosmetic Act. As such, there are no regulatory classifications or product codes or definitions for these such products. Well, that left a lot of people kind of in limbo. One of the things that they left out was obvious by its omission, was that they made no comment about PSAPs and their ability, or if they could be used, for some individuals having hearing impairment. So immediately when the 2000 proposed guidelines came out, there were challenges to this. Challenges came from individuals that were especially concerned about the definitions and the use of such products. A citizen petition, again, was filed in 2014 by Dr. Meade Killian. He says, why don't you just leave the PSAPs remain as unregulated in the 2000 guidelines? We understood that, but the 2013 guidelines has no clarification in it. Dr. Goodman petitioned also and said, well, this actually exceeds the authority of the FDA in that it negatively impacts the availability of a consumer product. And the PSAP is not a consumer product. You've got it, it's actually a consumer product, it's not a medical product. And under the FDA definition, by definition, you're really applying some kind of restriction against a PSAP, which isn't applied by the rules of the government to begin with. Well, other people jumped in on this as well. The consumer electronics industry. I don't know how many of you people are really familiar with this organization, but if you ever go to Las Vegas in January of every year, the biggest consumer electronics show in the world is held in Las Vegas, Nevada. And I'll tell you, it's hard to even get into the place. Every consumer electronics that you can think of is located and is available there. But they had conducted a study in 2014 of about 3,500 U.S. adults, people in the United States. And what they did is they looked at it and they found out that it actually strengthened the case for permitting PSAPs to be sold to address mild and moderate hearing loss. They found in the survey that cost was a major barrier, but PSAPs, could help overcome this. Let me just make one comment on the cost. There have been a lot of studies that said cost is not a big issue relative to hearing aid purchases. And it depends on which study you look at and what it has to say. In talking to Dr. Sergei Kochkin, who's done a lot of work on this, he said, as you look at all the surveys that have been done, even though cost may not always be the number one issue, it seems to always at least be in the top 4 or 5 comments that people make relative to hearing aids. I'll just leave it at that. The Consumer Electronics Association said there is actually a strong demand for PSAPs as reported among the consumers, the people that are, that we had on this survey. They said 40% would actually be interested in purchasing PSAPs over the counter. Of these, they would be willing to buy them from drugstores, big box stores, online. There are other options available, but this is really what they were saying, what they found in this. Another group that jumped in this was the telecommunications industry. And they looked at this and they said, well, we looked at the 2013 guidance, and we need to find that there has to be much more clarity in defining a PSAP versus a hearing aid. And they said a PSAP is not a medical device, but a consumer device. And many consumer ICT technology products would actually fall into the hearing aid device category, including smartphones, if you follow this, which meant that a smartphone then would have to follow the FDA guidelines and everything as a hearing aid, not as a consumer product. They said, this doesn't make a lot of sense to us because we have a lot of products already that enhance hearing in varying environments. And these would have to be called hearing aids under your guidance. This just doesn't make any sense. So they urged the enforcement discretion for PSAPs that may meet medical device definition, but which pose little or no potential risk to consumers. And this was really a big issue that came up in the lead up to the 2017 hearing aid rule, because many physicians wrote in also and said there really are no issues here with respect to the potential risk or damage to consumers from a PSAP product. So anyway, the FDA, had already done away with this for mobile medical devices and provided for discretion, even though they were medical devices. They didn't have to follow specifically the rules of the FDA for medical devices. And they said, you really ought to allow PSAP labeling and marketing materials to address hearing loss. Well, With all of this activity, the government agencies obviously began to have an interest. Not that they didn't have an interest all along, because it's a government agency, right? And so you can pretty well expect that they were interested. But at any rate, they took a renewed look at hearing aid sales and distribution, but then they looked at it more from a consumer point of view rather than a regulatory point of view. And so there was a certain pathway, certain things that occurred along the line and sequentially as to how the 2017 hearing aid over-the-counter rule law came into place. In 2009, in that time period, the National Institutes of Deafness and Communicative Disorders, they had a working group on accessible and affordable hearing health care for adults. In other words, they spent a lot of time in this government agency looking at it, looking at all the research, all that had been written about it, what the positive issues were, what the negative issues were, what the different stakeholders had to say that were involved, what they thought about how this, what was happening. In 2015, a Pcast report came out. Pcast is actually, as it says here, this is actually an advisory group of the nation's leading scientists and engineers, and they directly advise the President of the United States on issues and recommendations, relative to understanding science, technology, and innovation. And so they make these recommendations directly to the President. And so this is the leading scientists and everything that are involved with this. In addition to that, another group that got involved was the National Academies of Science, Engineering, and Medicine. Some people refer to it still as the NAS, the National Academy of Sciences. But the point is they got involved also, and this is another advisory group that provides nation's preeminent source of high-quality, objective advice on science, engineering, and human matters. And they looked again at the Hearing Health Care Report. And then eventually today what happened, we had the Over-the-Counter Hearing Aid Act, which was based on looking at information that came from the 2009 reports, 2015 reports, 2016 reports, and today. Well, let's take a little look at some of this here. The first of these that had a big impact was the Pcast advisory activity. The Pcast, this is the President's Council of Advisors of Science and Technology. And so they actually looked into hearing aid distribution, hearing aid sales, consumer concerns, requests, etc. And they held a series of open workshop meetings, and people were invited to it. Everybody from the industry was invited to it. They were totally open. And what they did is that they looked at the delivery models. They looked at the goal of growing accessibility to hearing technologies. And they even do some other things, okay? The button doesn't always work. And they recommended to the FDA in their report to open the market for innovative hearing technologies. They said, why don't we designate a market or a category of a basic hearing aid and then adopt rules for that particular class? And let's make this available as an over-the-counter product. And we will exempt this class from what we call the QSR, the Quality System Regulations, that are in place for a medical device. In other words, I've been doing that. One of the things that obviously enters into the QSR is that there has to be a lot of research and development and a lot of data collected and evaluation of the product to meet medical device regulations. They also suggested withdraw the draft guidance of 2013, that had come out to replace the 2009 guidance. They said we should broadly define PSAPs as devices for discretionary consumer use intended to augment, improve, or extend the sense of hearing in individuals. And they shouldn't require language that's so confusing in PSAP labeling and everything that excludes individuals with age-related hearing loss no worse than mild to moderate hearing loss. Well, the rationale for Pcast, they had a big rationale, and the reasons they said we came out with these recommendations was, first of all, as we looked at it, one of the things I think you people realize here that's different than what we have in the States, you have a National Health Service. In other words, that provides hearing aids to individuals. We don't have that in the U.S. In the U.S., hearing aids are purchased privately for the most part, individually. There's no support. There are a few insurance companies now, maybe about 10%, that offer some partial support on a rider that you may have on the policy that you purchase. But hearing aids are basically purchased by individuals, from their discretionary income, if we want to look at it that way. And they said if we look in the United States, the costs and risks of untreated hearing loss relative to aging is very great. And there's an unnecessary high cost of hearing aids exist. In the United States, hearing aid prices, even now, average price is, I guess I looked at the latest one, was about $1,800 to $3,000 for a single unit. And they were saying, well, if you're talking binaural units, you're talking up to possibly $6,000. And this seems kind of out of the range for a number of individuals, especially who are elderly. And let's face it, even for some people who have hearing loss, but just don't think their hearing loss is severe enough that they need $6,000 worth of help. I'm not going to get into those arguments with them. And they said another thing that happens, there is a conspicuously low pace of innovation by manufacturers in hearing aids as compared with other consumer electronics. Now you might say, that's not true. Look at all the technology that we've developed into these products. But what they were saying is that if we look at a consumer product comes out, a lot of people get involved with it and the price drops because people are looking at different ways and they're building them different ways. But we don't have this in this industry because we have essentially what we call a vertically integrated incumbent industry. As you know, we have 6 manufacturers worldwide that sell about, 98% of all the hearing aids that are sold. I mean, this is a fact. And they're saying, the government was saying, and the Pcast was saying, there is very little incentive for them to do anything different in terms of making costs more readily available and even making them more accessible to individuals because there is no motivation for them. They have this internally. Another thing that as you look at this slide, this is in the United States. You probably can't read it very well, but I'll just kind of explain it to you, the graph on it. And this talks about private sales of hearing aids in the U.S. The red area on the left is about 26%. Those are the independent sales of hearing aids in the United States, 26%. All the rest are either done by big buying groups or by the manufacturers themselves. As you know, manufacturers have their own retail operations. So they're saying we really don't have a very good accessibility because we're kind of limited right now in what we have available to us. And so by accessibility, they're not just talking only about the number of offices that are there, but they're talking about ease of access to a product, whether that ease of access is some other way, by online, by not having to go to the office, by any other method that is there. They don't have the accessibility that they'd like to have. And also in the states, they're operating in the context of long-standing state and federal regulations that actually discourage potential new entrants. In other words, you have state licensing. In state licensing, you have to be licensed to sell a hearing aid. And in doing that, by not having other groups being able to come in and sell products that are what we call a hearing product of some kind, and by having these restrictive regulations, it also has impeded, the distribution and the accessibility of the product. So they recommended actions to the FDA and to the Federal Trade Commission to open the market for innovative hearing technologies and increasing opportunities for consumer choice. The FDA held a workshop following the Pcast Report, and they reopened the comment period on the 2013 guidance. And they discussed what kind of good manufacturing practice regulations should be there to ensure the safety and effectiveness of hearing aids. They said the FDA should open discussion on the over-the-counter classification, and they should ask these questions. Should traditional hearing aids be available for over-the-counter sales without medical treatment? Should the FDA allow PSAPs to be marketed as designed to treat hearing loss? And what about self-fitting, self-treating, self-monitoring programs? In other words, it had been brought up, well, some people could probably self-fit themselves with amplification. They don't necessarily need to go into a licensed professional to have this done. And so they addressed all of these different issues. And they gathered this information from all the different stakeholders involved, whether it was from the manufacturers and hearing aid industry, associated bodies, the independent audiologists, dispensers, consumers. They looked at a lot of different groups and gathered information, and all of these people came into the meetings and responded to some of the requests. The reactions to the Pcast for over-the-counter hearing aids were probably as we might expect. At least I would have expected this. Consumers were for it. Audiologists were mostly in opposition. Hearing aid dispensers strongly opposed, and the hearing aid manufacturers strongly opposed this. The AAA came out with a statement, the American Academy of Audiology in the States. They came out and they said, well, at least relative to medical clearance removal, we agree with that. Let's get rid of that because it's unimportant. And then they just made a statement relative to that, but they didn't address any of the other issues at this particular time. ASHA, the American Speech Language Hearing Association, commented on and said the FDA should focus on the need for audiological evaluation. This is mandatory, this is required, they said. I find it kind of interesting for those of you that are not audiologists, if you happen to be a hearing aid dispenser, these people always ignore, for some reason, the hearing aid dispenser in this. And I think this has put some people out of line also. They said there is a continued need for audiologists to be involved in determining an individual's degree and type of hearing loss. That's kind of an interesting statement there because in the US, audiologists are not able to diagnose hearing loss. They can test hearing, but you cannot diagnose. Diagnosis is a medical function, and you cannot diagnose hearing loss. And so it's kind of an interesting statement by them. The International Hearing Aid Society, or Hearing Society, this is a group of dispensers, they said, we're just not aware of evidence to support efficacy and safety of these recommendations. We don't see how they would positively impact, responsible accessibility costs or the use of hearing aids in a meaningful way. So basically they said, we just don't see that there's anything to this. During this time period, though, the National Academies of Science had been operating as well. They had been running a series of meetings and studies and everything else, and they were independently evaluating affordable and accessible care. And these were the two big terms that has come out of all of this, what I call the double A. The first is affordability, and secondly is accessibility. These are the two things that they worked at and that they tried to concentrate on, I would guess, as they looked at all of this. And so what they did, they had a committee on accessible and affordable hearing aid care for adults. And they held a lot of workshops for the stakeholders. They had 5 public meetings. They did a deep dive analysis. And they looked at all things. They looked at device and, the technologies, and they looked at, the regulations and delivery systems and all of this type of thing. Had a lot of people from all over the US come in and comment and report on these kinds of things. And then they came out with their report. And their report was a big written report called Hearing Health Care for Adults, Priorities for Improving Access and Affordability. And basically, basically the report stated, and this is kind of interesting if you read this very, very carefully, it says, people who need hearing health care services and technologies should be at the center of their own care, with the option to make decisions about what is the most appropriate care for them. In other words, rather than having somebody else determine what is important for them, they said it's very important for the consumer to determine what's important for them, and we have to keep this in mind. They recommended support, total support of the Pcast recommendation, and removal of the medical waiver, and also to deregulate the market. They called on the FDA to establish a new over-the-counter category of hearing aids for mild to moderate loss. Now, accessibility has always been an issue. And let me just point out a couple of slides here. I have a couple of slides, talk about access. as we look at it from an audiological point of view, because I don't have this from a lot of other information. But if you look on the left part of this graph here, you'll see this says a number of audiologists is what it is, and the red line is a projected need for the number of audiologists, and blue line is a projected growth of audiologists. In the US right now, we have about 15,000 audiologists. I should mention not all of them actually dispense hearing aids, because many of them are in universities, many of them in research, many of them in other diagnostic localities and facilities. And on the right then, there's another graph that talks about the labor market for licensed healthcare professionals. And on this one, you can't read it, but on the far left on the bottom, it says psychologists. The next one is audiologists. The next one, occupational therapists. The next one, physical therapists. And last one, optometrists. And they're looking at the years from 2012 to 2015, a 3-year time period, and looking at the growth of these different professions in, during those time periods. And if you look, they all had a pretty positive growth, except the second one, which is audiologists. Audiologists actually had a minus 3.3 improvement in the total of audiologists available during that 2013-2015 time period. So people looked at this and they said, well, hold it. If we look forward, if we aren't meeting the need, then really, doesn't this lend this industry open to encroachment by individuals from outside the industry? Because we're not being able to keep up with the need for individuals. This is an interesting diagram here. And this is looking at audiology AUD programs in the United States. Just to give you an idea, the blue line is the year 2009, 2010. The red line is 2014, 2015. And what you see here, I don't have a pointer here, but on the 2009 line here, you can see there were 70 AUD programs in the United States in 2009, 2010. 2014, 2015, 71, they gained one. The number of applications to those programs for the 2009 period is 3,249, and for 2014-15, 6,017. And you might ask yourself, well, why is this big growth? Why were so many applications in that particular time period as opposed to the earlier time period? Well, it's interesting in that there were a couple of publications that came out in the United States saying the following. If you're a graduate in school, one of the best places to make the most money is being an audiologist, okay? And the other thing that they said is that it is also the least stressful of all jobs that you can have. Now, if you're in a graduate school, that's two big incentives right there, aren't they? And so the applications really jumped up during that time period. But what's more interesting and more critical here is we look at the number of program capacity. Even if we talk about 2014-15, the program capacity was 797 students. Of those 797, that was the capacity. They didn't get that many in there. They had 784 that actually enrolled in the program. Some people dropped out for one reason or another. So that then you look at the total enrollment, you say it was 2,793. Why is it so high? Because some of these people are in school for 2 years, maybe even 3 years. So it's a cumulative number at that point. But what's even worse is when you look at the last line, the degrees awarded. 623 degrees awarded in a year. And even if you're looking at attrition, it just doesn't hold up. There just isn't enough here. So if you look at there were 71 AUD programs. That's 8.7 students per program. They have a capacity of 11 per program. 80% of them graduate. That's 7 graduates per year. Attrition is 20%, and maybe half of those go into hearing aid sales. So when you look at accessibility, aside from other issues, we don't even have a group. Now, I don't have the hearing aid dispensers, but we know they have not been increasing at this rate either, okay? So the thing is, accessibility, it's not only a matter of hard people out on the ground that you can actually come to, but even if we looked at it that way, there's no way that we can accommodate the number of people that we have out there that need amplification. Now, the hearing industry's response to these meetings, they said, well, yeah, but you know, what we really need to do is we really need to have over-the-counter hearing aids subject to the same regulatory oversight as traditional hearing aids, in particular over-the-counter hearing aids with wireless features. In the US, hearing aids have to go through a 510K, which is a class 2 or class 1, depending on which way we look at it, document. And they also said they have to meet FDA's quality system requirements for medical devices. So they definitely, the Hearing Industry Association, they want them to be medical devices and not consumer devices. The consumer industry had actually said, in gold here, they'd argued that general quality standards for consumer products would be sufficient to ensure the safety and effectiveness as over-the-counter. And they also had to meet ANSI standards, S3.22. And they said there should be some additional requirements as well. If you're going to do self-assessment, if the patient's going to test their own hearing, then have a mechanism for doing this, then what you need, they have to have proven, verified, and validated tools. It says you have to require evidence demonstrating that the consumer can handle an over-the-counter product safely by themselves. They had to be able to do it by themselves. It should be, and they should be banned from making hearing loss treatment claims, and they still need professional guidance, even for self-testing, and the FDA should draft guidance to reflect all of that. If we look at the audiologists' general comments about the over-the-counter market, and I've kind of summarized these, I tried to make it short here, they said, we think that over-the-counter and direct-to-consumer hearing aids have their place. We think that's really true. But, big but, the majority of adults with mild to moderate age-related hearing loss, for them, a guided process including fitting verification and auditory rehabilitation is needed to achieve maximum benefit from amplification. And they said there really ought to be, audiological care. What they did not mention in all of their comments was anything relative to the accessibility and affordability. So, it was one of these things. They said over-the-counter products, hearing aids, may be a reasonable self-treatment option, but only used if it's in conjunction with professional collaboration for the vast majority of people with mild to moderate hearing losses that don't seek treatment through the delivery medical model. Well, with all of this happening then, you can pretty well guess, the government got involved again, this time through legislative action. People had been reading about this. People had gone to the legislators. They'd talked to them. And so in 2016, the U.S. Congress, the House of Representatives, and the U.S. Senate actually got involved. And so they introduced in 2016 the Over-the-Counter Hearing Aid Act. It was introduced late in 2016, so it never really got, to action by the end of the year. But what they were asking for at that time, and this was reintroduced in 2017, they said these are the goals. We would like to make certain types of hearing aids available over the counter for mild to moderate loss. We'd like to remove unnecessary and burdensome requirements for consumers who could benefit from hearing aids. We want the FDA to issue regulations containing safety and labeling requirements for the over-the-counter, and they definitely need to revise or update the draft guidance as related to PSAPs. With this, the Academy of Dispensing Audiologists supported the over-the-counter legislation, but with the following caveats. They said, yeah, we support this, but all over-the-counter products must be specifically labeled and include a strong recommendation that a patient seek a comprehensive audiological evaluation from an audiologist or physician prior to purchasing any device for the treatment of hearing loss. And the only reason I'm pointing some of this out, because remember, these are the groups that are involved, but most of them had been kind of looking out for themselves. And that's really what happens here. They're looking out for themselves. It has to be an audiologist. Couldn't be a hearing aid dispenser. Had to be an audiologist involved. Labeling should state the device is a non-surgical air conduction hearing aid intended to address mild to moderate hearing loss. you heard the presentation yesterday, I think. We were talking about degree of hearing loss. What is mild hearing loss? What's a moderate hearing loss? What are the limits? Is it 20 dB, 25, pure tone average, two frequency average, all the frequencies? What is it? You know, it's strictly arbitrary. Nobody knows what a mild hearing loss is, what a moderate hearing loss is. These are arbitrary terms. I mean, we can make them up all day long. It doesn't make any difference. So it was pretty inconclusive what this really meant. They said all amplification devices should adhere to defined maximum output thresholds. That's no problem. You know, they said, well, they were concerned that maybe they would be too loud for the individual. It's kind of interesting. We were talking yesterday, I think. One of the groups suggested that the maximum output should be 85 dB, SPL. Well, if any of you know, if you have an 85 dB output SPL, if you have speech, normal conversational speech at 70 dB input, and if you have 20 dB gain, you're exceeding the saturation output of the hearing aid for normal conversational speech. So I mean, some of the recommendations just don't make a heck of a lot of sense. You have to look at them in terms of what the reality of the situation is. The Hearing Industries Association came out. These are the manufacturers. And they agreed with the basic idea of increasing accessibility and affordability, but they said they were concerned about the legislation because it intended to create a new category of over-the-counter hearing aids. And they were concerned primarily, they said, as the requirements for consumers to self-diagnose the cause and degree of hearing loss before the purchasing of a hearing aid was of concern to them because they felt there should be some professional guidance. And, you know, this is just what they had to say. The AAA staked out its position to the over-the-counter law. They said they would remain proactive to ensure the federal policymakers understand the importance of audiological care. Efforts will shift toward directly engaging with the FDA and the FTC to shape new over-the-counter regulations. And they said, especially with respect to over-the-counter hearing aids, we want to be involved in the timing and the rulemaking. We want to provide suggestions to the FDA about over-the-counter hearing aids, and they want to ensure that the FDA continues to consider the over-the-counter unit a medical device and not a consumer device. The AAA had a certain number of suggestions to label the over-the-counter. They said the consumer should be advised that better outcomes are achieved when a comprehensive audiological evaluation is conducted prior to getting an over-the-counter hearing device. They said they should address utilization of over-the-counter devices really for people over 18 years of age. No problem there, the laws already were that way. And they said also they should advise consumers to seek an evaluation by an audiologist if they're not receiving satisfactory results with an over-the-counter device. This was kind of countered by another group that says, well, who do we contact if the hearing aid device isn't being, applied and the persons weren't doing very well with it? They specified the need and output may exceed levels that could cause either additional hearing loss or an initial hearing loss in those with normal hearing. And so they said, you have to devise the characteristics of the hearing aid, the electroacoustics of the hearing aid, so that they don't, avoid those, or to avoid those, rather. They said, let's advise consumers to seek an evaluation by an audiologist when they notice any change in their hearing, including temporary changes, as sustained, long-standing exposure to moderate to high output levels may have a negative impact on hearing. Okay? Specified that over-the-counter devices are medical devices and not consumer electronics. So you can see the big argument now here in this whole thing gets down to, are we going to call it a medical device, or are we going to call it a consumer device? Okay. ASHA changed things a little bit, and they said, well, we audiologists ought to be involved, but these should only be available for perceived mild hearing loss. Okay? The Hearing Loss Association of America, a group of consumers of hearing aids, says, hey, the cost of hearing aids has been a #1 issue with our groups for many years. People should have hearing aids but can't afford them, and legislation is a step in the right direction. So the over-the-counter hearing aid Act of 2017. The 2016 bill was introduced, and it was passed in July 12th by both the Senate and the House, signed into law by the President of August 2017. And what it did, and just very basically, it says it allows hearing aids intended for use by adults to compensate for mild to moderate hearing losses to be sold to consumers over the counter. Of course, the medical clearance had already been eliminated. They tasked the FDA to issue appropriate regulations for safety and labeling requirements, and that meant the draft guidance had to be redone. That's not been done yet. And they figured there's 3 years to rewrite the draft guidance for over-the-counter hearing aids. Has to be published in the Federal Register. The public has to have an opportunity to respond before the issuance of the final rule. And speculation says that, well, you know, what should be and probably will be included, and it's strictly speculation because nobody knows at this time. There will be probably labeling requirements in there, that's for sure. Probably some kind of user warnings will be in there, and limits for gain and output. Other than that, we have absolutely no idea what was in there. One group came up with a group of suggestions and recommendations, and as I looked at them, the recommendations for the over-the-counter hearing aid were actually much more stringent than for the traditional hearing aid. Any rate, that's all I wanted to say. It was not a presentation that had a lot of mirth, merriment, and levity in it, okay? I'm usually used to being out there talking among you people and trying to get things done. But anyway, that kind of gives you an overview of how it came about, what's involved, and where it is now. It is law, and we're just waiting for the rules and regulations by the FDA to come out, and we'll see what happens then. So it probably doesn't apply directly to you, but at least you can see what's been happening with us and the process that people went through and what some of the thinking was in terms of trying to get this out to individuals. So I really appreciate the opportunity to have been here, and I hope that at least you got something out of it to kind of fill you in so you know what the process was that we went through in our country. So thank you very much.